In the movie Independence Day, there's a scene where actor Jeff Goldblum loses all hope and gives up on humanity. At this crucial turning point in the film, his father comes in to offer some words of wisdom.
Because, sometimes we have to remember what we still have.
Like what? Well,
You still have your health.
Now, I think this statement reflects an all too common attitude or notion that health is the absence of disease. There's more to the concept of health than simply not being sick. And the very phrase, "you still have your health," indicates that health is a foundational aspect of life. Without good health, a living creature will die, so our health as individuals and as a society is absolutely essential. So it's very important that we, the general public, have a thorough understanding of health. And that can be difficult in this day and age because the many scientific disciplines that build our modern understanding of health and wellness have all undergone an explosion of growth and development in a relatively short time. And as a result, there's still far too many lingering superstitions and outright lies and falsehoods in regards to public health. In some cases, it's just honest misunderstanding, where in other cases, people are deliberately misinforming the public. Now, snake oil salesmen are nothing new, but their tactics seem to be flourishing in an internet age where the growing complexity of science can be very difficult for the general public to keep up with. And this is why I'm making the argument that health and science education should be the prime focus in our public school system. Now, a quick look at population growth throughout history can show us where this absence of disease model for health came from. It's because for the vast majority of our time on this earth, the population rested somewhere below 500 million. The death rate was traditionally very high, and it was infection and illness that was by far the most common cause of death in human history. Polio, for example, may have been with us since the days of ancient Egypt. The two most well-known plague outbreaks were the Plague of Justinian and the Black Death. There was also smallpox, malaria, leprosy, anthrax, tuberculosis, cholera, influenza, strep throat, and the common cold. Throughout human history, if you were not sick and dying a miserable death from one of these or many other conditions, then you obviously must be healthy. Now, looking back at our global population timeline, we can see the effects of the Black Death. But shortly after that, something amazing happened. Something that had not happened in the entire history of life on Earth. The development of an objective method to arrive at conclusions about the natural world. And the result on the population growth and the well-being of the people was nothing short of incredible. Some of the most notable works of that time are those of Francis Bacon and Isaac Newton, and even though they didn't deal directly with health, the scientific rationalism that they're famous for did have direct effects on mortality, and for obvious reasons. For the first time in history, human beings had at their disposal a method for solving problems and gaining insight. Years later, John Snow would use that method in his works on the communication of cholera, which was published in 1849. In 1854, he was able to locate the source of a cholera outbreak. It was the public water pump that became contaminated, so the pump handle was removed and history was made. Ironically enough, the site of the original pump became a restaurant and pub. So if you have the interest, you can grab a burger and a pint of lager on the site of the most famous cholera outbreak in history. Now, around the same time, Dr. Egan Semmelweis proposed what was then a crazy idea, the idea that physicians should wash their hands before delivering children. Semmelweis published comprehensive data to illustrate the correlation between hand washing and lowered mortality, but he was unable to explain the mechanism. And as a result, his ideas were rejected and he was later institutionalized, where he died shortly after. A few years later, a man named Louis Pasteur made significant contributions to the germ theory of disease. And now that there was a model for how disease came to infect the body, Semmelweis finally got the vindication that he deserved. Pasteur also developed a method of eliminating pathogens from milk products, as well as the first vaccine for rabies, and this was all in the late 1800s. So let's take a look at the growth in global population after that time. The growth is exponential, and the exponential growth is clearly due to the scientific rationalism of figures like Bacon and Newton, and the further application of those methods in regards to public health. It was at this point that the focus of health had to change. Health was no longer about survival because, for the most part, if you had a disease or an illness, medical science could help you. Granted that you had enough money to give you access, but that's a whole separate economic issue. The point I'm trying to make here is that if health is no longer about survival, then what's it all about? It's about thrival. It's about thriving in your environment, and an even better word might be the Greek word eudaimonia. Medical science might be able to keep sick people alive for longer, but just because you have a pulse, it doesn't mean that by any means you're living a healthy, flourishing, eudaimonic form of life. And this is all reflected in Abraham Maslow's hierarchy of human needs. The hierarchy is depicted as a pyramid, and we can see that the base of that pyramid is constructed of physiological needs, followed by safety and security needs. Now, different people and different demographics are at different levels of need stratification, and therefore they have varying health needs that require different approaches and different methods. Now, it's pretty clear where the survival and thrival line is drawn in Maslow's pyramid, and I would argue that this line is drawn largely in terms of economic stability. To illustrate that point, let's look at the leading causes of death in different income brackets. In lower income countries, the leading cause of death is lower respiratory infection. Next on the list is diarrhea, followed by HIV/AIDS. In middle income countries, heart attack, stroke, and chronic obstructive pulmonary disease are the three leading causes of death. In high income countries, the leading causes of death are heart attack, stroke, and cancer. Fourth on the list is Alzheimer's and other dementias. Now, it's interesting to note that these are all chronic conditions that develop over a very long period of time, and that's because wealthy people have the luxury of succumbing to these conditions after a long life. Notice that people in low-income countries die of similar conditions that claimed lives in the ancient world, primarily infection. And it's no coincidence that those places often hold more religious values of the ancient world than rational values of the scientific age. Now, considering the leading causes of death in Africa, it becomes pretty apparent that a successful health initiative is going to focus more on vaccinations, contraceptives, and public water treatment, whereas in the United States a larger focus might be given to stress management, diet and exercise, and of course drug and alcohol abuse prevention programs. With different health concerns and approaches, there's consequently different categories of treatment. Those three approaches to treatment are based on different levels of disease progression. They're primary, secondary, and tertiary methods of treatment. Now, health education is a relatively new field, and unfortunately it's not getting the emphasis that it deserves. With a good understanding of what health really is, it becomes clear that a healthier individual is more capable of overcoming the obstacles that life has to offer. I'd like to digress and finish this video with an analogy. In the 1995 film Billy Madison, Adam Sandler plays a young adult who decides to repeat the 1st through 12th grade. And it isn't long before Billy realizes that now he has an incredible advantage over all the other kids that were once his peers. It's as if school somehow magically got easier. Now, we can improve performance on a task in two different ways. The task can be made easier by lowering standards, by extending deadlines, or by cheating. The other approach is to strengthen the individual, and this can be done by improvements in health, furthering in education, or in the case of Billy Madison, the mere passage of time. Now, the great thing about strengthening the individual is that it strengthens their ability to overcome all other obstacles, and this is what applied health education is really capable of. It raises people to their highest level of potential and their optimal level of function. A healthy, well-rested student with a balanced diet and moderate activity level is, at a physiological level, more capable of developing new neurological networks that can better absorb and process information. A healthy individual is less likely to succumb to illness, and therefore they're more likely to attend class or work. A healthy person is far more likely to contribute to society, and a healthy society is far more likely to produce healthy individuals. If we take serious action to improve public health through improvements in public education, then through the Billy Madison effect, the next generation will be much better equipped to undertake the many serious problems that we and our parents are leaving for them.